One, and I hear this often, and I've heard it at the gym with I was taking a HIIT class, and this one woman next to me was like, "Oh, well, I can't do the jumping ones because I've had kids." And the instructor goes, "I have two." I tell the moms, "Don't worry, you don't have to jump," because it's the conception that there's a misconception that if you are a mom or postpartum, you're gonna jump and you're gonna pee your pants, and that's normal. And I hear that all the time. People will come in and be like, "Yeah, well, I do pee my pants if I jump, but I've had a kid or I've had two kids." And I'm like, no, it's not normal. So it doesn't matter how many kids you've had, your age, whatever it is. It's never normal to pee your pants.
Welcome, everybody. Welcome to the Wednesday Wellness Debrief. I am your host, Brittany, and I'm joined here by the lovely Christine. Say hi, Christine.
Hi, everyone.
I want to thank Christine for joining me. I'm really excited. I found her on Threads, and I was just like, ooh. I was so excited to touch base with her, especially about pelvic floor health. Especially as I'm going through my process of becoming a pre- and postnatal fitness specialist and health coach. I'm learning how important pelvic health is basically through your entire life, not even when you're pregnant, just how important it is. So I wanted to bring in a subject matter expert to come in and help me break down the importance of pelvic health. You're going to have to help me. pelvic floor health. Yeah. And just how important it is just for your everyday life. So first, I want to get to know, who is Christine, my guest? Who is Christine?
Well, thank you for having me, Brittany. I got my doctorate in physical therapy before PT school, and while going through PT school, I had no idea what I would do. Didn't really think I'd be a pelvic floor specialist, but it was the path that I feel found me, and I became very passionate about it. So in undergrad, I've always liked exercise. It started when I was 16. My dad put me in boxing classes, and I was like, okay, I love this. This is so fun. And in that studio is where I found my love for movement. At that point, I had no idea what I was going to do with it, because I didn't really, I was like, okay, do I be a personal trainer? Didn't even think that anything within the fitness was available to me as a career. So I went to college. I think my major was business or undecided or something random. And I worked in a financial firm doing loan servicing processing. And if you ask me what that means, I barely really understood what I was doing. I was doing paperwork in a cubicle all day. And that's what got me through undergrad. And then during that time, I also got a job as a party planner, which was really fun, but also very different. So it nothing had to do with health or physical therapy or anything. And then still during that undergrad period, for some reason, I don't know what happened, but I ended up joining a biomechanics research lab. And my preceptor was someone who did research on boxing and the mechanics of boxing and why your hip is so important and all these different things. And that's kind of how I found him, because it was oh, this is a shared interest. So I did research in his lab and I loved it. And then it was kind of the path is either you go into research, go into becoming a personal trainer, athletic trainer, or you go into physical therapy, or none of the above and choose something completely random. From there, I did my research on okay, what is physical therapy? Is this something I'm actually interested in? Got a job as an aide at a clinic, and I loved it. It was really, really fun. So I applied to physical therapy schools, got into my dream school, which was USC. And then during that time, I thought I was going to go into neuro as a specialty, because I loved neuro. I was in a neuro clinic for one of my rotations, fell in love with it, and I felt it was very impactful, and it was different than sports. So to me, sports felt okay, well, everyone's healthy and doesn't really need me, which I know is also not true, but that was just how I felt.
Mhm.
Neuro was like, oh my gosh, I'm like making an impact in people's day-to-day life, like getting off a chair or doing this or doing that. And then my very last rotation in school was for 3 months, and I did it in a pelvic health setting.
Mm-hmm.
And I chose that because years, like 6, 7 years before, I had seen a pelvic floor therapist for problems I was going through, and it helped me a lot. But it was like a memory that I just kind of forgot about until I started like looking at clinical rotations, and I completely fell in love with it. So that's kind of my journey. Now my life looks like I work full time at like a hospital treating pelvic health. And I recently started my own company, which is virtual and has like exercise programs through this community called School that you can register for. And I post content. So I'm like trying to figure out what my next steps are. Cause yeah, I'm doing these 2 full-time things, but I'm enjoying it and I'm trying to maintain my health because that's really important for me. I gave you a whole spiel. I gave you my life story.
No, but I like understanding the foundation of what made them come to the decisions that they've come to. And it sounds like you had like the fitness background and then you kind of went through what a lot of us.
The finance thing was weird. It was, I did not fit into that world.
And it's hard when you're like, like that's the right career or it's the money making career, but it's like, it doesn't fit you internally.
Yeah, absolutely.
But I'm happy you found something that is Christine, I think.
Yeah, I really do. There are moments where I'm like, oh my gosh, this is such a cool thing that I'm doing and it's my job. And it's very like humbling, and I don't take it lightly that people come to me and tell me things that are so personal, like I'm having pain with sex, or I'm about to have a baby and I'm scared, or I just had a baby and I like don't know who I am anymore and I'm peeing my pants, and all these different things that really do impact women's lives so deeply. And so to have the ability to be a place where people talk about these things is not something I take lightly. And I love it.
Well, I'm excited to get into the weeds with you and dive deep. So we're going to start with understanding pelvic floor health, because I don't think a lot of people, probably even coming to you, don't even realize they have those issues, or even if it was an underlying issue, especially pertaining to pregnant people. But for probably many of our listeners, they might not know exactly what the pelvic floor is. Could you break down what these muscles are and why they matter so much?
Yes. So if you look at your hips, your pubic bone, and your tailbone, everything in between those is your pelvic floor. And so that's right in the center of your body. There's muscles, ligaments, blood supply, nerves, all these different things in that area. And it's important because it has a few different roles. And when we talk about it, I want you to think of it like a trampoline, a mini trampoline in the middle of your body. And it acts as a sling that holds your internal organs up so that they're not falling out of your rectum or your vaginal opening or anywhere else. It also supports your baby when you're pregnant and keeps everything up and held up. That's one of the big roles. The other things it does is it supports our like bladder and bowel patterns. So when I go pee, in order to fully pee, my pelvic floor muscles have to lengthen and relax. And that's how pee comes out. Same thing with bowel movements. Throughout the day, they have to have some type of tension to be working in order for us to walk and go upstairs and sit and breathe and do all these things without peeing our pants or, having like an accident with bowel movements on our pants. They help with sexual function, so making sure sex is enjoyable and pain-free. They help with stability, so it's at the center of our body. So when I'm going upstairs, it's my pelvic muscles that keep me stable. When I'm running, it's my pelvic muscles that make sure my hips aren't like moving all over the place. And they help with circulation. So again, they're in the middle of our body, so they play a role in circulating blood and lymphatic fluid and all that. So that's kind of what they are and what they do, because most of us don't know what they do. So even when you're having, like when you have a baby, those are the muscles that need to work to help you, give birth. If you have a vaginal birth, if you have a C-section, well, those muscles are also impacted because, it's an opening in the abdomen, but your abdominal muscles are part of your pelvic floor muscles because they connect and share similar connections. So they impact each other. Did I answer the
No,
question?
you answered it perfectly.
Sometimes I feel like I forget the question. I just go on and on.
No. You answered perfectly. I learned that in my specialist degree where it's like a canister, where it's like your diaphragm, the transverse abdominis, and then your pelvic floor. And so, you explain it perfectly, kind of tying it in the pelvic floor, that high-level athletes sometimes develop pelvic floor issues similar to postpartum women, even without having children. What's the connection between athletic training and pelvic floor dysfunction, and what can listeners learn?
What can we do about it?
Yeah.
1 in 3 women will have pelvic floor dysfunction.
Oh, wow.
And 1 in 7 women will have pain. So, because when we talk about pelvic floor dysfunction, there's different types. So there's, I'm peeing my pants. There's, I'm constipated, or I can't fully empty when I go. There's, I pee, but it doesn't feel like things are actually emptying. There's prolapse, and there's a bunch of different types of prolapse. There's pain with intercourse. There's just pain, like I'm sitting here and I'm in pain. And then there's other things like inability to orgasm, or like different stuff when it comes, like in each category, there's a bunch with athletes. And I've heard this a lot, like the athletes that are sprinters or heavy lifters, and they're like, oh, and it seemed like a badge of like honor or pride. Like, I lifted so heavy, I peed my pants.
I've heard that, yeah.
Right? Or like, I ran so fast and I ended up peeing my pants. Or I was friends with some like track and field athletes who were like, yeah, sometimes I would like, I'm running and I'm like, oh my gosh, I'm peeing myself while I'm doing this. And so there is a lot of athletes will have some sort of pelvic floor dysfunction, whether that's pain, incontinence, constipation, whatever it is. It seems to me, so I don't have the evidence, the research evidence to support this, but from my experience, it seems like we are not focusing on certain body parts when it comes to these athletes. So if you are always like lifting, running, jumping, sprinting, whatever, your muscles, let's go back to them being like this trampoline. You want the trampoline, when you jump on it, to lengthen and then for it to shorten so it could bring you back up. If the trampoline is too rigid, you're going to jump on it and you'll probably like hurt your foot or fall off or whatever. If it's not sturdy enough, you're going to fall right through. And our pelvic floor is the same. So we want it to have both. We want it to have strength, but we want it to have mobility, because when I'm running or jumping or lifting, my muscles are going to go through this like lengthening process and shortening process, even when we're breathing. So if we take a deep breath into our belly right now, our pelvic floor muscles are going to lengthen. And when you breathe out, they're going to shorten. And if you really just focus on like your vulva or your vaginal area, you might actually feel it like, oh, okay, I do feel like more opening as I breathe. I sometimes tell people, pretend you're breathing through your butthole, because that like get them like, okay, to focus on breathing like more in the pelvic floor area. What I've noticed happens with athletes is either one, where we are focused so much on the tightening part that we forget after a heavy lift or after a heavy exercise, we should down regulate our nervous system because everything's all heightened up. So a cool down is really important. And a cool down that's like, maybe you go on a little walk and then you take a few minutes, do some deep belly breathing, and you do a happy baby pose or thread the needle or something to get movement and mobility. And I mean that in a way of like, we're not just stretching, because if you're an athlete, you probably have pretty good mobility, but are we taking our nervous system from being on high alert, like I'm running, I'm sprinting, I'm lifting, whatever, to, okay, now I'm just living day-to-day life. Let me bring it back down. And so a cool down that's more for our nervous system is really important. The other part of this is runners love to run and then they forget to do other things. So runners will spend so much time running and then not as much time with their strength training. So if you do not have the strength in the supportive musculature to help you, you will have a hard time focusing on my foot mobility, my foot strength, because your foot is the first part of the chain. Whether you're a runner or not, you're just squatting or walking or whatever, your foot has to have good mobility and be strong and keep you stable. So you should be able to stand on one foot and balance. So that's part one. The second part is, okay, is your leg strong and do you have good single leg strength? If you're an athlete, you should be strong on single leg and you should be stable. Now, how's your glute strength? How's your core strength? How's even your trunk? Are you strong? Are you addressing the rest of the body? So with the athletes, I think we really need to zoom out and look at the whole forest of what are you doing, and do you have a program that's encompassing of, taking care of your nervous system, but also all your other body parts, and you're not just doing this one thing all the time, because other parts will get weaker. And there's studies on athletes that play multiple sports and how it actually helps them be better at their main sport.
Mm.
Yeah, because they are now developing more skills, with different skills, developing different muscles. And so that's really helpful. And that's why kids, this is so random, unrelated, but I'm assuming if you have kids, you might want to know this. Kids should not be a single sport kid. So the kid that's doing multiple sports will be better in the one sport they want to do versus the kid that's nope, I play soccer and that's all I do all year round.
No, I'm a dancer, so it makes sense. So it's just I love a particular dance style, but I take other forms of dance. I'll take a K-pop class, a hip hop class, a heels class, just to keep that rotation in my brain going, and it makes me a better dancer.
Dancers are my other big population because
really,
dancers have a lot of flexibility usually, and sometimes they are good with everything else, but their pelvic floor coordination, they'll have a lot of trouble coordinating it. And so I get a lot of dancers that experience some pelvic floor dysfunction or a lot of hip pain that they're oh my gosh, my hip. I've gone to chiropractors, I've gone to PTs. This problem has been for so long. And if it's truly not a hip problem and we've ruled out the hip, it usually ends up being pelvic floor with dancers.
Wow. That's interesting. And honestly, I've gotten better because I teach a strength training class. So I've had to learn all those techniques you were just talking about. And it has actually improved.
Good.
Improved parts of my body. So you are correct with youth learning multiple sports. Because I'm a dancer, but I was I've gotten into yoga and mobility training and strength training, and it does help in the long run, especially as I get older. And I don't bounce back.
Right. You feel it.
No, I feel it 1,000%. And it's hard to go into something brand new when you're so used to something, but it actually helps in the long run, honestly. But on from understanding the pelvic floor and anatomy and function to common misconceptions. So you've probably heard a lot of myths about the pelvic floor health. What are some wrong ideas you wish people would stop maybe saying out loud? You're ooh, I understand why you would say that, but that is very wrong.
Okay. Two huge ones that come into play. One, and I hear this often, and I've heard it at the gym with I was taking a HIIT class, and this one woman next to me was oh, well, I can't do the jumping ones because I've had kids. And the instructor goes, I have two. I tell the moms, don't worry, you don't have to jump, because it's the conception that there's a misconception that if you are a mom or postpartum, you're going to jump and you're going to pee your pants. And that's normal. And I hear that all the time. people come in and be like, yeah, well, I do pee my pants if I like jump, but I've had a kid or I've had 2 kids. And I'm like, no, it's not normal. So it doesn't matter how many kids you've had, your age, whatever it is. It's never normal to pee your pants. Just because it's common doesn't mean it's normal. The second one, Kegels or Kegel. Some people say Kegels, some people say Kegels. I say Kegels. There is like an overemphasis on doing them. Like there are people that are doing Kegels all the time. They're like, oh, I do them when I'm sitting in the car, or I do them when I'm at a red light or at work, or every time I remember, I just do a few. Why? Like, what's the point? There is none. And sometimes it just makes your muscles overworked and really tight. And then you run into problems like peeing with sex or peeing your pants or peeing a lot. Mm. And so Kegels are not always the answer. I hardly ever give Kegels as an exercise. If I do, it's just to get the coordination and then like add other things, but that's not always the answer.
Yeah, no, you go like on your Instagram or TikTok, you're like Kegels, Kegels, Kegels. Like, oh, okay. Yeah. I guess that's important. And even what you said about the peeing, that's something I'm learning. And my pre and postnatal of like, that is not normal for even postpartum for you. Like, oh, I peed myself. And that's why I was like, I need to bring a pelvic floor expert on the podcast to kind of help break down. To kind of help break it down, because I'm still learning, and as an instructor, especially with teaching group fitness, and I get a lot of pregnant people and postpartum people. I want to be able to, like, yeah, you need to go talk to somebody about that.
And I appreciate that we are all always learning, and that's like the nice thing about our professions, because there's always so many things. Like whether there's always so much new information coming out in the fitness world, in the PT world, and there's a lot of overlap between them. And so it is really nice that we're in a place that we are always going to be learning.
1000%. Yeah. And again, I appreciate those 2 big things, because I was like, oh yes, the first one for sure. The second one, the Kegel one, I'm like, yeah, I can see that.
Yeah.
For other misconceptions, some pelvic floor specialists argue that the fitness industry's emphasis on core strength, and I think you talked about this briefly, through activities like planks and crunches actually contribute to pelvic floor dysfunction in new mothers. Should there be a regulatory oversight on postpartum fitness certification to prevent harmful exercise prescriptions? And I'm in a program, and so core strength is something that is focused, but they do kind of go through like the trimesters of like, this is what you should do, this is what you should not do, this especially I think it's like 3 to 4 months after the mom gives birth, when she's cleared to go, you still treat her like she's like in her 3rd trimester type of thing. I'm not sure if there could be more regulatory oversight on postpartum fitness certifications that prevent harmful exercises.
Here's the thing. This is a tough question, because I feel like if I am going and getting a postpartum certification, I care, right? So and I don't know, I will say I don't know about the certifications. So I don't know enough to have a say on them, because I don't know how they do things. Because in my head, it's probably very like science-based. If it is a program that's science-based, that takes into account like individual differences, that is well-rounded. So it's not just like, okay, we're just going to do planks all day, or like keep your stomach tight all day long, or wear like the thing around your belly all day. If it's what I'm imagining, that it's a postpartum certification that's evidence-based, that takes into account the individual, and that's up to date, I think great. That's an amazing thing, and we need more of that. The part that gets like sticky is anyone can go, like any trainer can just be like, is probably working with someone postpartum, because oftentimes I don't think that we even realize like, oh, there's different instructors. Like there's a postpartum specialist that's a trainer. There's a pregnancy specialist, whatever. So most times people don't even know. And so you're just with like a trainer that maybe is not up to date with like knowing this. Maybe they've never worked with a pregnant woman before, or postpartum, so they don't know all these things. That's when I feel like, ugh, like you should go see someone that is educated on this topic. But other than that, like, I think it's great. Like, I think there needs to be more when it comes to the overemphasis on core. I actually think that there is a problem for all of us women, because what do? We're always like, oh, let me suck in my stomach. Oh, this picture, let me suck it in. Oh, I'm walking. Like, oh my God, let me suck it in. That's where the pelvic floor dysfunction develops from. It's this sucking in that we're doing all day long. Some people are doing it without even noticing. So I'll have some people, I'm like, okay, just like relax your belly. And that's a foreign concept. That's like not something they've ever done. Or like breathe into your belly, and they can't do it because they are so like, I've spent 30, 40 years sucking in. Now you're telling me to just like let it be and breathe into it. And that takes a lot of retraining. So I feel like that's where most of the pelvic floor dysfunction comes from, because listen, I love a good like mat Pilates class or like a core 10-minute core workout on YouTube. But after it's done, I'm also done activating. Like, I'm like, okay, I'm not going to spend my whole day sucking in or tightening up. So I do think it's fine. I think there has to be an emphasis on core strength, but overall strength, because something I'll see on social media is like postpartum, and then all the focus is on core. But we're forgetting that this mom is now carrying a baby and is like hunched forward, or, you know, has like, so her arm strength needs to get better. Her back strength needs to improve. Her like chest and mobility there needs to be worked on too. So I think we focus on the one thing that maybe is like a bigger insecurity or concern, because everybody wants like, oh, I want to have a nice stomach, or like, you know, I just gave
the
birth.
Snapback, as they would.
That's the word.
The snapback.
And we forget like, okay, well, your back is really weak, and you're like, now you're hunched forward, and now we're developing all these other problems.
And that's something that I'm learning in the pre and postnatal of like, don't hold your breath in, breathe through your body. Yes. And especially activities of daily living of like, you're picking up the child, you're holding the stroller and the bag and all these other different things. Like, you have to focus, your core is important, but you have to focus on everything else in your body to train it.
Absolutely.
Basically, which is really important. That was a controversial question that my researcher found. So,
so it is a controversial question, because it's like, it depends. Because I know there are trainers that I'm like, I send my like patients to it. I'm like, oh, they're amazing. Like, they are good, and they practice in a way that is ethical and that's evidence-based, and they will help you. But there's some where I'm like, okay, you're just doing whatever looks fancy on the internet. And so you got to find, it's hard sometimes.
No, as I'm starting to dive into the fitness world, I'm noticing it. I'm just like, oh, I want to be able to properly communicate to my pregnant participants that walk in and my postpartum participants that walk in. I want to make sure that you have a safe and effective workout, and that you are not leaving with any injuries, or if I send them to a pelvic floor therapist, like, where did you learn this technique from?
Because sometimes like, it's usually, I've had trainers are the ones that will send people to me, like patients, and be like, hey, like, can you, or clients or whatever, be like, hey, I think this person has a problem. Can you check them out? More so than doctors sometimes, because there are some doctors that have no idea what we do. They don't know, but like the trainers know or work closely with us or have other clients that tell them. So it's interesting.
It's a different level. It's just different levels. It's different specialists that understand. Like, the doctor understands the body, but the fitness trainer knows the body a little bit differently. It's like, oh yeah, this is something that needs to be worked on. Where doctors more scanning and stuff.
Absolutely, like, and they know we exist. Like, I have friends that are medical doctors, and they didn't even know. I don't even know if they know what my job is still. Like, they think, oh, you're a physical therapist, but they don't know, like, no, like, these are the things I treat. Now that I post online, people know what I treat. But before that, nobody really understood. Like, they thought I treated hips. Like, the pelvis. And so it's very interesting.
Okay. Well,
Yeah.
oh, well, I'm glad this controversial question has led us into pregnancy's impact on the pelvic floor.
Yes. Yeah.
And we'll talk about what actually happens to the pelvic floor during pregnancy and how do these muscles change as the baby grows inside mommy.
Your internal organs move when you're pregnant because now there's something else in there that's like moving them around. And there's research. Some research says it never goes back to normal. So like it changes and now it's forever changed. During pregnancy, so that happens to the organs, but then now you have a baby in there that's putting more pressure on the muscles. So they do lengthen a bit. And you might find it harder to coordinate your muscles because they're now, like if I was used to always having, I don't know, it's hard without pictures, but if I was always used to having a fist, like my hand in a fist, and then suddenly I held a ball and now my hand was in a bigger fist because I'm holding a ball in my hand. The coordination of my like fingers and wrists will not be the same because now it's changed a little bit. It's not what I'm used to. And so sometimes coordination can be affected. That's during pregnancy. But I always tell people it's temporary. You're going to have your baby and then your body will get used to this new normal of where your organs are. And your muscles our muscle fibers, our sarcomeres are so cool. When you're pregnant and your abdominal muscles expand because your baby's growing and growing and growing, they lay down more sarcomeres to help you so that you can use your abdominal muscles. And then once you give birth, now you don't need them, so we get rid of them because now your stomach has gotten smaller. So our body is very, very strong. It is very adaptable. It is very resilient. It's smart. It knows what to do. So there are changes. Yes, your abdominal muscles are going to stretch. Your pelvic floor muscles are going to have difficulty with coordinating. Your organs are going to move. But you'll be okay because your body knows what to do. I will say this is a time to focus on like glute strength, coordination, even like abdominal activation. Like I cue moms to like, okay, hug your baby when like with your ab muscles. And that's a good way to activate abs to like pick stuff up and move. There's some changes, but our body's smart, so you'll be okay.
Well, that makes me excited that our bodies are, I think it's trusting your body. I think a lot of us are just like, we want to know what's happening, and just having that understanding of like, trust your body knows what's happening and understands what is going to happen. It's preparing you for the future, basically.
Absolutely.
And that's really important. And then we're moving on to the next thing for physical changes during pregnancy. How does limited education about normal pelvic floor function before problems occur reflect a broader issue of bodily autonomy and informed consent in women's health care?
Okay. This is going to be one of those, I'm going to give a super, super long answer.
I'm here for the
super, I'm going to go on a tangent, and I'm warning.
I want to hear it all. Let me hear.
So, warning. One, let's start. Okay, hang on. I'm going to step back. So I'm going to give you like a little insight of what happens during our in-person sessions to talk about consent. And then I'm going to zoom out and talk about how, like, if we don't know, we end up not knowing what's normal and what's not normal will cause a lot of women to live with dysfunction for a long time. This is my tangent and the hill I will die on. Women need to be strength training. It will help with so many things. So it will help you during your pregnancy. It will help you postpartum. It will help you during menopause, postmenopause, all that. At age 30, we start losing 3 to 8% of our muscle mass every decade. If you are not strength training, you lose it more rapidly. Then you have hormonal changes. You lose more strength. Strength training, our skeletal muscle is the biggest organ in our body. We need to be strength training because it will help with everything. when women don't know the importance of that and don't know the changes that happen to our body, we don't know like, oh, this is actually vital for not just how long I will live, but how well I will live. And so then they're not really prioritizing strength training. So then they end up having all these other problems. But if you don't know that it's not normal to pee your pants, you're just going to buy pads and dismiss it as a normal thing that happens, because you also might not feel comfortable talking about it with your doctor or your friends or whatever. Or if you do talk about it with your friends, they also don't know it's not normal. So they're like, oh yeah, happens to me too. And now you're both just like struggling. Or if you have pain with intercourse and you're like, I'm having pain, you might not want to feel comfortable talking about it with your doctor. If you tell your friends, they would either, the response, and I had a patient tell me this, she's like, my friends, there's two responses. Either, yeah, I have it too, it sucks, or that sounds like it's horrible. I'm so sorry you're going through that. And that's it. But then there's always like some random person that's like, oh, well, I had it too. And then I went and saw a pelvic floor therapist and it really helped. But we just don't know. And I think there is a lack of, these topics can be embarrassing or seen as shameful. And so you don't talk about sex, don't talk about your vagina, don't talk about your poop, all the things not to talk about. And so we have to talk about it because that's what will educate women. Then like my sessions look like an hour of just sitting there talking, where like my client tells me stuff, I'm educating them, and we're going through it. If it's an in-person session, with their consent, so I have an anatomy model, I show them all the muscles, and we will sometimes do an internal muscle assessment. So that means with gloves on and a finger and using a water-based lubricant, I'll go internally through the vaginal and or rectal opening. And I check to see sensation, muscle strength, coordination, all that of your pelvic floor muscles. Now, I am always very considerate that people might not want this. So I give the option. You don't have to do this. This is something we can do to understand. And I tell them exactly what I'm looking for. And I let them know it's an ongoing consent process. So at any point during our treatment, whether it's, not internal and we're just talking and you're like, I'm uncomfortable, I don't want to do this anymore, we can stop. I don't know if this answered your question.
No, that answers my question. And I think having that education, and especially as women, I work in healthcare as well. So it for women, sometimes it's hard to say no or consent, just having that autonomy, like, yeah, I don't like this, or let me rephrase it. How some like, well, I trust this provider because I select this provider and they know my body better than I know my body. So even if it's uncomfortable, I'll just say yes.
And that's the thing. I don't care how many times we've done an internal treatment or examination. I'm always like, okay, are you okay with this? And we move slow. And if I feel resistance, I'm like, okay, I can tell you're uncomfortable. We're going to stop. And sometimes patients are like, no, I want to learn. It's just painful, but I want it. And I'm like, nope, we're not doing it. This is like not okay. You shouldn't be this uncomfortable. That's important, is to like let people know, like, we can stop at any time. You're in control.
And I think that's, for me, that's why I'm learning about the pre and postnatal and becoming a pregnancy health coach, just to kind of give people the option to like, you can say you don't like this. You can vocalize and I can document it and you can give it to your provider saying your yeses and nos. I think a lot, especially women, a lot of times we don't feel that we have the right to say yes and no with our providers, unfortunately.
Yeah. And no is a complete sentence and it's okay. You can just say, no, I don't want to do this. It is our job as like providers and trainers and physical therapists and whatever to find something else. So I'm like, they're like, well, now how are you going to know what to do? And I'm like, don't worry about it. That's not like, that's my job. You're not comfortable with this. We'll figure something else out.
Exactly. And that's what I'm trained to do.
Yeah. Two things I want to add for this tangent. One, I always ask for consent before touching patients too. like, even if it's like a shoulder or stomach or whatever, especially with pregnant, like, I'm like, is it okay? Because it's very sensitive. But then not in education, if women are told not to exercise during pregnancy, not because it's a medical problem. So it's different if you are medically like not cleared for exercise. But if you're okay to exercise and you don't do it, you increase your risk of gestational diabetes. So if we are saying don't exercise, we are actually promoting, I don't know what the word, unhealthiness, disability, I don't know.
Well, I know exactly what you're saying. I'm learning it where there's no like study that says that staying still is beneficial. And actually there's stuff that's it's more, I'm learning it's more harmful because it's not enough knowledge and education where the I think it's the American office, it's where the OBs, they're like 30 minutes of exercise. It doesn't matter the exercise, as long as there's 30 minutes in, like we need to get that in to kind of help with everything. And I'm still going through the yeses and no list in my certification, but it was very emphasized, like, no, exercise actually helps. And it helps not just the mommy, it helps the baby as well. And
yes.
It makes it easy, and it makes it easier for the provider, and it makes it easy for mommy through pregnancy. And I do not like bouncing. I don't like the word bounce back, just adjusting to their new life as motherhood.
I like that too.
I try to avoid like the bounce back and snap back. So I'm just like, you're a new person once you've
and it's okay.
Exactly. It's just to acknowledge, like, it's okay, you're not the same person, and you may need a little bit more adjustment, and things change your body. Like you said earlier, your body completely and totally changes. You may need a little assistance.
Changed. It's okay.
Exactly. And so that's why I want to bring you on, just to say, like, it is okay. And it's fine. There are people out there. There are multiple people out there that are offering a service that can help you in any form of fashion.
Yeah.
But moving on from pregnancy to postpartum, what problems do you see most often in your practice when new moms come in to see you for any services?
Yeah. So I will say this, it is not abnormal to feel a little bit more pressure in your vaginal area immediately postpartum. It's okay. That might be a little bit of prolapse. It will get better, and you won't feel as much pressure down there. I do have people experiencing like incontinence and stuff like that, but I do notice that one of the big things is like, I just feel weird. I feel off. Things down there feel different. And my answer is, well, because it is different. We go through like the anatomy that it's changed. It takes 2 years postpartum for your hormones to balance back out.
Oh, wow.
And so, it's a long time. So I'm like, it's different because it is. So I'll see just overall feeling of like, I don't feel like myself, or some incontinence, some pain, especially if it was like more of a traumatic birth experience, or there was a lot of tearing, or even a C-section. I'll feel like the area where the stitches are is uncomfortable, or it's hard to sit, or things like that. And so those are very common things that do get better, but you just might need the extra support.
Yeah. Kind of going into what symptoms should a new mom never ignore, and they know, okay, I need to go see a pelvic floor therapist to kind of help me, and I shouldn't ignore this anymore.
I want to say everything. So like even low back pain and neck pain, and some people are like, oh my gosh, I'm getting like numbness down my hands now, but it's really from the neck. So there's so many things. A physical therapist can help. A pelvic floor physical therapist can help you postpartum if you're having any type of pain, if you're having any type of leaking urine, if you can't have sex, or you're scared to have. Some people are more scared. They're like, I haven't done it, but I'm scared to do it because I'm scared it's going to hurt because nothing has been up there, So everything, come see us. We can help. And then if we can't, I mean, most of us are very good at saying, okay, this is not me. Let's go find someone else. But any leaking of urine, any leaking of poop, any constipation, any back pain, any hip pain, even like neck and shoulder and arm pain.
I didn't even think of neck and shoulders, honestly, but it's all tied in together. And in one full body. So I can see people coming in like, my entire body just feels off. We're like, okay, so we gonna figure out.
Exactly. Because it probably does. Like, you've gone through this huge life change and you're not getting as much sleep. You're not getting as much nutrition. Things are,
Yeah,
you're
your body,
adjusting.
you're exhausted.
Yeah, you're adjusting a lot.
From postpartum pelvic floor challenges to the assessment process. So this may be introspective from your perspective. When we look at healthcare spending, pelvic floor therapy often isn't covered by insurance until problems become very severe. Yet we know prevention is more effective than realizing, treatment, basically. How might our healthcare system change if we value women's preventative pelvic health as much as we emphasize prenatal care?
Oh my gosh, I think it would be so, I would be so happy. And that was kind of the driver for me starting my social media, my like blog, like all my stuff, was to provide information of this. This is what it is. These are the things you could do to prevent it. If you have it, these are the things you can do to solve it. If we understood what we needed to do, that we need strength, that we need mobility, that we need to be walking, we could avoid a lot of these problems. Because I will say this, sometimes people come in and I'm like, you just need to get stronger overall. Like, you need to start walking, you need to drink a little bit more water, eat better food, get more sleep, and do some exercise. I don't think pelvic health it's not complicated, but it's not simple. So it's like, it's simple, but it's not easy. That's the word. So if we could educate women, like, before anything, like, these are things that irritate your bladder. This is how much water you should be drinking. This is the type of exercise you should be doing. I think we'd be in a much, much better place.
And sometimes it's just that simple. I think I will speak for myself. Sometimes you overthink. You're like, no, I need to do this. I need to do this. I need to do this. And you're like, no, you just need to do these handful things. We'll kind of monitor. If it does get to a point, then we'll escalate it. But like, let's start from the foundation.
Absolutely.
So we can see what's really going on.
Yeah.
And I think that's important. And as I've been, little background about me, I worked in hospitals, and especially when I first started my career, I worked especially with like the birthing population.
Yeah.
And so it was always emphasized like prenatal, get to the doctor at the beginning. But I think there was one thing when I would go see the mothers on the floor of like, what happens to them when they leave? What happens to the baby when they leave? Like, it's what right, no one, right? That you get one doctor's appointment, and I'm just like, and I was just like, and sometimes again, I'm not a mother, but I go to the OBGYN. I'm just like, I'm sitting there waiting an extra 20, 30 minutes for the doctor. I'm just like, ooh, I'm anxious. So, and my hormones are all over the place, and I haven't had a brand new baby. So I can imagine, I'm like, I don't feel like I'm being cared for. I don't feel like I'm being talked to. I don't feel like people are focusing on me. Everyone's focused on the baby, but not me. And that's something that from talking to you, you really are integral in their growth and kind of figuring out who they are as a new mom and a new person, honestly.
Yeah, because for the first time, it's like, okay, this is an hour a week that's all about you. And I'm really not even asking about your baby. Like, I'm just asking just you.
I think that's integral. I don't think a lot of healthcare providers realize how integral that is, the mental health aspect that is offered.
I always refer to mental health therapists. They're like one of my number one referral. I'm always like, okay, I think you would really benefit from having a mental health therapist as well. Because the nice thing is when you're seeing people so frequently, you'll start to see like, something's going on there. And so like I had someone who I talked to last week and I was like, hey, like I've been seeing you for like 6 months. I've noticed after you had like this surgery, you have been different. Are you feeling down? Are you feeling depressed? Whatever. And I was like, yes. Okay, here's a number, make an appointment with behavioral health and like get a mental health therapist. So it is nice to be able to provide like, hey, I see you, here's a referral, because mental health therapists are amazing and we need them in the pelvic health world.
Oh, you can say it again, that a mental health therapist is, speed dial. It's amazing.
Yeah.
So from therapeutic approaches to timeline recovery. So how long does pelvic floor therapy recovery typically take? Like, if a new mom is wanting to go in, like, what? I don't think there's like a perfect, like, there's nothing perfect.
No.
What is their expectation when they go in?
I would say if you were postpartum, you're probably coming in at 6 weeks postpartum or 8 weeks. Actually, you know what? I'm going to take this answer back.
Okay.
I will say it depends a lot about like how long you've had the problem for, like where you are at. So that, like, if I've had chronic pain for 10 years, it's not going to take 3 months to go away. But if this started like 2 months ago, or I gave birth a month ago and it started then I say 8 to 12 weeks is usually the like point where you're like, okay, I'm actually feeling a lot better. It takes our bodies 6 to 8 weeks to build strength. And we get like 4 weeks of just trying to figure out what the heck are we doing? Like, what muscles are we activating? What's going on? And so I say give yourself a solid 3 months.
Okay, a solid 3 months. I think that's, again, that sets a thank you for saying that, realistic expectations. Because again, pregnancy kind of, if you already have the issues, it already kind of puts your foot on the gas and just kind of.
Yeah, exacerbating. Yeah.
Exactly. Pushes it more to the service. To the ceiling.
It's early. It's okay.
I know. It's almost lunchtime for me. So factors affecting recovery. For partners listening to this episode, what specific ways can they support a new mother's pelvic floor recovery that go beyond just general help with the baby?
From what I've seen, and this is just strictly from the like pelvic floor standpoint, maybe give her 30, 45 minutes, an hour, so she could do things, self-care for her a day, where she's not interrupted by the baby, where she could do her exercise program for physical therapy, where she could go on a walk, do all these things. From my perspective, that would be helpful, because I know that's the big thing that moms will tell me. I like try to get this in while the baby's sleeping, but then I'm also trying to sleep. And so if they can have a little bit more support, I think that would be very helpful. Yeah.
There's an article that I saw that when like the children come, like the exercise decreases significantly, and it does not help at all.
Yeah.
From recovery to self-care strategies, when we consider mind-body connection, stress and trauma are stored physically in our tissues and muscle patterns, how might addressing pelvic floor tension through physical therapy potentially release emotional patterns stored in the intimate muscles after the profound experience of birth? And I think you briefly talked about it a bit.
Yeah. So, I mean, our body holds, there's that great book, Our Body Keeps the Score, or The Body Keeps the Score, where it talks about
heard of that, yeah.
A body keeping score of traumatic events and things like that. It is sometimes just talking about the experience can be very emotionally triggering. And so there are times when, like, before even you start physical therapy, you might need to go through mental health therapy or do them together to help you. And reliving that experience can sometimes be re-traumatizing for people. And so we have to be very sensitive as providers and aware of like the person we're with.
No, and that honestly, that makes sense. Honestly, it's all interconnected. It's all interconnected.
Yeah. You can't, like, there are people that will say, oh, I get this pain like right here. When does it come on? Oh, there's no pattern really. But then when you dig deeper, it's like, oh, it comes on every time you're stressed. And so our body is very good at holding stress in different places. So noticing that if you're I would say pay attention if your symptoms are related to your mental health. When you're sad, are they worse? When you're stressed, are they worse? That would be something to really be mindful of for everyone.
No, you're not wrong. No, as I'm getting older, I'm realizing, ooh, I'm feeling the burnout symptoms. Let's take a moment, take a step back.
Yeah. There was a day I got so stressed that like I felt my back like really tighten up, but it was like so stressful and so tight that I had like a full on, like my hands got numb because I was having like just like a full body nervous system response. And so I knew like, okay, I think this is just like this. Let me go home. Let me do some deep breathing. Let me do some like yoga. And that was my body saying, hey, take care of me and take care of your mental health.
Yeah. And sometimes you just need to listen to your body, even though you're like, no, I have things I have to do. You're like, no, my body's like like you said, your body keeps the score. You're like, no,
rest is productive.
No. And that's something I have to tell myself, and you probably have to tell clients of like, rest is actually productive for you to keep functioning.
Yes. Like we need it.
Like it's important.
Yeah.
And our last question, and it may be a little bit, it's one of the controversial questions that my researcher gave me. And we kind of briefly touched on it. The taboo around discussing pelvic floor issues creates unnecessary suffering for millions of women. What would need to change in our conversations about women's bodies to make postpartum pelvic health as normal to discuss as pregnancy itself?
I think we need to talk about it. So something I'm loving is like on social media now, people are coming out and saying like, oh my gosh, like normalizing things that are common. Like, oh, I had a baby and I'm like peeing my pants and now I'm going to physical, like documenting that they're going through these things, or like other physical therapists or mental health therapists that are coming on and saying like, these are the things that happen. Like whether it's talking about postpartum depression and normalizing it because it is very common. It's okay to talk about it without shame. I don't want to say maybe not normalizing wasn't the right word, but making it normal to talk about things like that.
That's not taboo. That is just like, it's something that happens taboo. And you're not a weirdo if it happens to you, basically.
Exactly. Postpartum depression is something that's very, very common, and it happens because of chemical changes taking place. It is so common. And the fact that like it's seen as taboo to talk about is crazy, but that's the same thing with pelvic health stuff. It's normal to have some dysfunction. Maybe you had prolapse and you feel heaviness and you feel like prolapse is when your organs fall out of you. For those that don't know, maybe that's happening and you're like, what the hell is going on? Why do I feel like a little bulge there? What is this? But you're just embarrassed. I think the more we talk about it and make it like, hey, this is okay, it will eventually, hopefully, make it easier for women to go to their doctor and say, hey, like, this is what I'm going through. Because, it's not like this weird, like you're not the only one going through this. There are other people going through it too. And there's treatment.
And more awareness brings more attention to it. And it makes people want to, like you said, have those honest conversations, especially if you're scrolling on your Instagram or your social media or whatever social media app you have going from that. Well, Miss Christine, I appreciate you so much for joining me. I actually really, I was very nervous to talk to you because I was like, oh, how is this going to go? How is this going to go? Is my education going to kick in? And it did kick in. And you've brought a lot of insight and guidance into me as I'm finishing up my certification for my pre and postnatal certification and my health coaching for pregnant participants. And I do appreciate you for kind of giving me a bit of motivation to kind of dive back into it.
When you're done, please let me know. I'm always looking for like trainers that are knowledgeable to refer patients to. So please let me know.
Yes, I would love that. Yay. Yeah. And I would love to, as we start to end the episode, I'll put it down below. And where can the people find you to schedule anything or even take some of your courses? Because I saw you promote courses that to kind of help with pelvic health.
Yeah. So you can find me on social media. I have Instagram, YouTube, TikTok, but my TikTok's like not that active, and Threads. It's at dr.christine Ballou. That's Ballou. My website is alluro.com. That's ALOORO.com. And from there, you could find my exercise program that has like strength, mobility, constipation. It's programs for different types of dysfunctions that you can do at home. It's called the Pelvic Playground.
Ooh.
Yeah, it was fun.
I was watching some of the classes. I was like, oh, these look fun. I was like, fun. I know it's like exercise is supposed to be fun, but it looks fun. I was like, oh, these look fun to do.
Yeah, they're nice to add in or do as a complete, whatever you want to do.
Oh my goodness. Well, Christine, I appreciate you so, so, so much.
Thank you
And
so
I cannot wait for the listeners to hear from a pelvic floor therapist. Thank you
Thank
again.
you
I
so
appreciate
much,
that.
Brittany. This was amazing. This was my first podcast, so I was very nervous.
Oh
So,
yeah, well, Lisa, so I'm happy to help you, and hopefully this kickstarts off you vocalizing and
let's
advocating
see.
for more pelvic floor therapy out there in the world that's needed. Honestly,
Absolutely. I would love that.
thank you.